Working in residential mental health care means navigating unpredictable daily realities. In these moments, you cannot rely on gut instinct alone. You need a structured medical framework to guide your response. The foundation of that framework is recognizing that mental illness is a biological condition of the brain. The people in our program did not choose these conditions any more than someone chooses to have diabetes. Their symptoms are medical events, not character flaws or moral failures. At Amend, we follow the recovery model. This is the conviction that people with serious mental illness can live meaningful, self-directed lives. Our job is to provide the hope and tools for self-management that make that recovery possible. While clinicians set the treatment plan, you are the constant presence in a client's day. This makes you our early warning system. You aren't here to prescribe or diagnose. You are here to observe, support, and report. Mastering this perspective turns frightening symptoms into manageable data points. When you see behavior as a medical symptom rather than a personal choice, you maintain the professional distance required to support a client's long-term recovery. Schizophrenia is a chronic brain disorder that often involves hallucinations. In this setting, you will likely encounter clients who are actively hearing voices or seeing things that aren't there. The most common failure point for staff is the instinct to use logic. Trying to argue a client out of a hallucination or mocking the content of their experience only increases their distress and breaks their trust. This diagram shows the clinical alternative. Instead of debating the facts, validate the emotion. The hallucination is real to the client, so acknowledge the fear it causes by saying, "I understand you're hearing something and that it's frightening. I'm here with you." Once you have verbally secured the environment and provided a sense of safety, you must immediately notify the clinical team. Documenting these active symptoms is the only way the medical team can adjust the client's care. Prioritizing emotional safety over objective reality prevents the symptom from escalating. It keeps the client grounded in your support rather than lost in the conflict of the hallucination. For clients with PTSD, the brain is hypersensitized to the environment. A loud noise or a sudden movement can be enough to trigger an immediate trauma response. During a flashback, the client is not just remembering a traumatic event, they are involuntarily reliving it. In this state, they are temporarily disconnected from their current surroundings and may not recognize who you are. The most dangerous error you can make during a flashback is initiating physical touch. Reaching out can be perceived as an attack, leading to severe re-traumatization or an aggressive defensive reaction. Your role is to serve as a verbal anchor, maintain a safe distance, lower the noise in the room, and state present-day facts. Tell them their name, where they are, and exactly what time it is to help pull them back to the present. By remaining a predictable, objective presence, you help the client's nervous system downregulate. You are providing the external stability they need until the flashback resolves. Bipolar disorder involves extreme emotional shifts. While depression is easy to spot, the transition into a manic episode is often more deceptive. Mania is a clinical emergency disguised as a good mood. A client who suddenly feels cured, hyperproductive, or euphoric is actually displaying signs of an impending crash. This grandiosity often leads to risky behavior and medication refusal. This chart shows the most reliable early warning sign, a sudden decrease in the need for sleep. If a client is awake for 20 hours and insists they feel great, they are likely entering a manic phase. When you spot this pattern, do not argue with their plans. Maintain the facility routine, set gentle boundaries, and report the sleep loss to the clinical team immediately so they can intervene before the mania fully takes hold. Preventing a crisis requires you to look past the outward energy. You are identifying the biological instability developing underneath the great mood so the team can maintain the client's stability. Knowing how to respond is only half the battle. You must also know exactly when to escalate a situation to the medical team or to emergency services. The clinical notification threshold covers signs of relapse. Tell the clinical team now if a client stops taking meds, starts withdrawing from meals, or talks about self-harm. This matrix identifies the 911 threshold. Call emergency services for active suicide attempts, imminent violence, seizures, or severe medication toxicity. Watch closely for high fever and muscle rigidity, signs of NMS, or a sudden lamotrigine rash. These are life-threatening events requiring an immediate hospital response. Your safety net is this binary decision-making process. By knowing the difference between a clinical concern and a medical emergency, you ensure the client receives the correct level of care without delay. This training moves you away from instinct and toward a structured framework. Every interaction you have is now informed by a medical understanding of these disorders. Part of this framework is person-first language. We don't call clients addicts or crazy. We describe the symptoms they are experiencing. This shift in vocabulary maintains the therapeutic environment and reinforces client dignity. Consistently validating emotions, grounding trauma, and reporting shifts in behavior prevents minor symptoms from developing into major crises. Your daily observations are the most important tool we have for preventing relapse. You are the foundation of this facility. By following these protocols, you ensure that EMEND remains a safe, predictable place for everyone who lives and works here. Applying this medical, non-judgmental approach provides the clinical stability our clients need to manage their conditions. This stability is the literal foundation that makes long-term recovery a tangible reality.